All right, so Miss Beard is a 86-year-old who just had a total hip arthroplasty. She's had a posterior approach and is post-op day 1. No complications were noted for her procedure, and she's weight bearing as tolerated on that left leg. So that means that she can put as much weight as she can tolerate through that leg, as we are doing ambulation and stair training today. Her pain is pretty well maintained. She reports it at about a 4 out of 10. She performed a sit to stand yesterday on low bed surfaces with minimal assistance, and she is going to be going to the gym today for therapy. Her range of motion on her upper extremities is within functional limits.
She has minor limitations
in flexion and abduction. And with the lower extremity, she's within normal limits on that right side. They did not test the left side because she just had surgery there. In terms of strength, her upper extremities were both 5 out of 5, so full strength. So we'll make sure to use both those arms to kind of help as she gets used to using that hip again. And her right lower extremity was, again, a 5 out of 5, so nice and strong. And that'll be useful again with the training that we're about to do. The patient presents with pretty good balance, but she's a little bit concerned, so we'll make sure to do some contact guard assist today with her so she feels nice and secure as she practices both ambulating with a rolling walker and going up and down the stairs with a cane. Because this patient has a total hip arthroplasty, she does have those total hip precautions. So we're going to make sure that she does not flex greater than 90 degrees, that she's not internally rotating her hip, and that she's not abducting those legs, so no crossing over. We'll make sure that she's doing this at all times, whether it's getting up, walking, going up and down the stairs. And because she has the total hip arthroplasty, we are going to use a rolling walker today for her practice with ambulation, just to give her a little bit of help as she's learning how to move around again. And then because Miss Beard also has 1 flight of stairs to get in and out of her home, we are going to help her practice getting up and down the stairs. The walker, however, will not fit up and down the stairs, so we're going to teach her how to use a straight cane to help her. She has hand railings on both sides of her stairs, but they're too far apart for kind of proper use of both hands, so we're going to give her that straight cane kind of to sturdy her out, 1 hand on the rail and 1 hand on the cane. We'll have her practice going up and down, up with the good, down with the bad. And we'll teach her how to use the cane to kind of help take some of that weight off her left side as she kind of regains her strength, how to get up and down safely, turn around, and use both sides, whether or not, depending on how she's getting up and down at home and what side's clear. So yeah, should be a good day.
Hi, Miss Beard. My name's Sarah. I'm the student physical therapist who's going to be working with you today from the rehab department. Is it okay if I kind of work with you and put my hands on you to help you get in and out of your chair? Yeah. Okay, awesome. So as you know, you had that total hip arthroplasty on your left leg. So because of that, you do have some precautions. We don't want you kind of flexing at the hips too much, like you would reach down to grab something off the floor. We don't want you kind of pointing those toes in. It's called internal rotation. And we don't really want you like crossing your legs when you sit or anything, okay? With that in mind, you are also weight bearing as tolerated, so that does mean that you can actually put as much weight as you can on your left leg when we're walking, okay? It's totally up to you, you know, as pain is tolerated, okay? So as we do that, we're gonna go ahead and try and practice getting you in and out of the chair, used to your walker, and kind of get you used to moving around with it, okay? So I'm gonna demo for you first. And what we do is we have you here in this chair. I'm gonna have you stick your left leg out. We're going to use our armrest to kind of scoot as far forward as we can. And then from here, I'm going to help you. We're going to push ourselves up. And as we get up, we can put as much weight as we need to on this leg. And then I want you to grab your walker, okay? I don't want you reaching for it as we get up because it's not really sturdy enough to kind of accept our weight as we're standing, but I will help you do that. Once we're here, we'll kind of go ahead and kind of check to make sure that it's the right height. And then we're going to go ahead and kick that leg down. We're going to reach back for our wheelchair as we sit down. I want you to be really careful though, because we have a tendency to kind of bend here. So I want you to kind of get as close as you can to your wheelchair before you reach back and kind of lean your trunk back as you sit down, okay? So once we do that, we're gonna go ahead and practice our walking. So we'll scoot forward again. We're gonna use those armrests to push off. Once we stand up, we'll then grab our walker. And our walker is kind of like a little helper for that leg that we're working on with that hip. So when your walker goes forward, your leg goes with it. And then your strong leg just walks like normal. So they go together, and then your other leg follows through. We can go forward. If we want to go to the side, the walker and your bad leg go together, and the other leg follows through. Both ways. They go together, and you can move. If you wanted to turn around, you need to be careful because we don't want that foot to be internally rotated. So if we're turning to the left, we want the walker and the foot to kind of point where we're going. And if we're going to the right, I really want you to keep those hips open and use the pointing of our toes to kind of direct ourselves. If we need to go backwards, you're gonna push through with your good leg first, and then you're gonna follow through with your walker and your bad leg. Push through, walker and bad leg. Okay, and then we'll come back. Again, we'll be careful as we sit down. We'll kind of kick that leg out, lean back, reach for our chair as we sit down, and we're careful not to flex, okay? Yeah. All right, we'll go ahead and what we're gonna do is we're just gonna try and stand up, okay? Okay. So I want you to scoop forward as far as you can in your chair. Yeah, very nice. Again, I want you to be really careful. I want you to keep your eyes up, kind of look off to the back of the room as we stand up here. Okay, ready? 1, 2, 3, push. Very nice. Then grab for the walker. Nice. Check it for your height. We're going to lift out our hands either side. Good. In line with the wrist crease. And remember, you can put as much weight as you can tolerate on that left leg, okay? Let's practice sitting down. So you're going to let go of your walker. I'm going to have you reach back. Yep. Very nice. Good job not to bend too much through those hips. Okay, now that we got that, we're going to add a little bit to it. We're going to stand up, take a little lap around the room, and then sit down. You're going to try and get up and walk around now, okay? So I'm going to help you. We're going to scoot as far forward as you can in your wheelchair. Nice. Keep that leg out. And then we're going to go ahead and stand up together. Okay, ready? 1, 2, 3, push. Very nice. Then grab for that walker. Nice. I'm going to have you put your wrists out real quick. We'll check that height. Looks good. Okay, now we're going to start walking. So remember, your left foot and your walker are going to move together. Nice. Right foot follows through. Very nice. And here, yep, put as much weight as you can through that left side. All right, let's try going to the side a little bit. So the walker and the left foot go together. Together, nice. And then follow through with your right. Okay, we'll go ahead and try and turn. Remember, try and keep your toes out. Very nice. Yep, you move that left foot first. Keep as much weight through it as you can, and we'll head back to the wheelchair. Nice, we're moving together. The right foot's on its own. As much weight as you can, and we'll go ahead and turn again. Using those scoop points. Very nice. All right, now I'm gonna have you back it up. So the right foot's gonna go first. Yep, push through with the walker. Scoot as close to the chair as you can. Now here, stick that leg out again. And I want you to really focus on keeping your head up so that we make sure not to bend too much in the hips. Go ahead and reach back. And then we'll go ahead and sit you down. All right, very nice. Does that feel okay? Mm-hmm. All right, perfect. Great job. All right. Hi, Ms. Beard. I'm Sarah. I'm the student physical therapist who's going to be working with you from the rehab department today. As we kind of went over getting up and down from the chair and walking around, we're going to try and get you used now to going up and down the stairs, since I know you have one flight to get into your house. And with that total hip arthroplasty, we don't want you again bending, forward to reach anything. We don't want you kind of pointing your toes in, and we don't want you bringing your legs and crossing them over each other, even when we're going up and down the stairs, okay? So obviously we cannot use a walker on the stairs. It's not gonna fit like we did while we were walking around. So we're gonna get you used to using this cane to kind of help you get up and down the stairs. You are still, weight bearing is tolerated, so I still want you trying to put as much weight as you can tolerate through that left leg, but we're gonna have the cane to kind of help you out, and obviously your strong right leg to kind of get you up and down the stairs, okay? So I'm gonna demonstrate for you first kind of how we're gonna get up and down, and then we'll go ahead and practice with you doing it yourself and me helping you, okay? So when you get to the stairs, I know you have railings at home on both sides. I want you just to go to whatever side you feel comfortable with. But whatever side your hand is on the railing, we're gonna have the cane on the opposite side, okay? And no matter what, as we go up, I always want you to lead with your strong leg. So for you, that's your right leg. You're gonna put your right leg up first, you're gonna push through it, use the cane to help you push up, and then you're gonna follow through with your bad leg in the cane. Again, right leg first, use the cane, push up, then the left leg's coming through. Every time you can put as much weight as you can tolerate through that left leg to kind of help you get you up, but feel free to use that cane. Stay going up with the strong leg first, that's your right leg, and following through. When you get to the top at home, depending on what side you're on, you're either going to turn towards the railing to kind of, you know, still have something to grab onto, or I'll have you turn towards the wall to kind of give you protection during the turn. And then as we come down, it's going to be the exact opposite. So you're going to keep your cane below you this time. So your cane is going to go down first with your bad leg, and you're going to use it to kind of take some of the weight off of that bad leg as you come down, and you're going to follow through with your strong leg. Again, the cane is staying on the opposite side of the rail because it's acting kind of as a second railing. Down with the bad, follow through with the good. Again, putting as much weight through that left leg as you can tolerate as you come down. Okay, all right, we're gonna go ahead and give that a go for you. I'm gonna hand you this. Let's check to make sure that it's the right height. Yep, that looks great, right in line with that wrist crease. I'll have you come to the stairs. And now, again, we're gonna go up with your right leg first. Yep, step, now push through, bring that left leg up, great. Here we go, 1 foot at a time. Nice, right leg first. Remember, you can put as much weight through that left leg as you need, and as is comfortable for you. Great job, right leg first, very nice. All right, we're now gonna have you turn. Great. And now here, it's a little bit different. Yep, switch that cane. And here we're gonna go down with the cane first in our left leg, yep. Put them down, sturdy yourself, come through, nice. Remember, put as much weight through that leg as you can. Use your strong leg to keep you going. Very nice. Good, yep. Down with the bad, follow through with the good. All right, very nice. That feel okay? Mm-hmm. All right, awesome. Thank you.